Let's talk about burial of COVID-19 patients. There's been uproar in Siaya, to be exact. That's where the main concern is right now as we speak. They were concerned that the burial of one of their own was not done in a proper way. That led to the apology by the Siaya governor. The Siaya Senator, on the other hand, is vowing to sue the country for that particular act. The family distraught after hurried burial. Their government says that all the precautionary measures during a burial must be adhered to. But on this particular one, the Siaya Governor Cornel Rasanga had to apologize over the inhumane burial of the COVID-19 victim in the county, conducted dead in the night, even as the county formed a committee to probe the hasty burial of the KPA worker. Siaya Senator James Orengo has threatened to sue the state over the burial that has sparked public fury, jolting the health ministry to release disposal guidelines for COVID-19 victims, warning that cultural burial practices will be disrupted in the interim.
A public backlash has greeted the hushed burial of James Oyugi, a COVID-19 patient in Siaya County over the weekend. The burial of Oyugi early Sunday morning is said to have robbed him of a decent send-off. Siaya Senator James Orengo now threatening to sue the state over the controversial burial and demanding a statement from the Ministry of Health. But in a quick retreat, Siaya Governor Cornel Rasanga formed a committee to investigate the matter, insisting the move was not sanctioned by the county's COVID-19 response team, which he chairs.
So we want to know, who is it that ordered for the grave to be dug? Ni nani?
The public furrow also getting the attention of the Ministry of Health officials.
That our cultural practices on how we dispose the bodies of our loved ones may not be practical in an extreme situation.
According to the government COVID-19 burial protocol, a special disposal team is to ensure self-disposal of the body without further spreading the virus. The body disposal team must have a family representative, a team from the public health, a local administrator, either a chief or assistant chief, and security officers. During the process, the public health team that will undertake handling of the body and burying it will include 4 members all dressed up in full protective gear, 1 sprayer equally fully kitted, a technical supervisor, a communicator, and a religious representative all not geared up in protective clothing. But before leaving for the deceased home for burial, the body disposal team must have a leak-proof body bag with a minimum thickness of 400 microns. The body bag should be able to hold at least 125 kilos, have 4 handles to carry the body around, and it should be able to contain germs from spreading. The team should also assemble an array of protective kits before setting off for the burial. Among them is a pair of disposal gloves, a pair of heavy-duty gloves, a coverall suit that is disposable, a face protection kit, and rubber boots. On arrival to the home, the team, which is yet to don in protective kits, should be courteous to the deceased family and offer their condolences. It is here that the team's communicator is to liaise with the family representative on the family's rights to the deceased. The team must get a green light from the family's representative before proceeding with the burial plans. After obtaining the go-ahead, the team will then systematically don their protective clothing from the rubber boots, sanitize their hands before proceeding to wear their full protective suits, followed by their face mask that will be covered by the protective goggles, after which they will wear their gloves and ready to handle the body. But before putting the body in a body bag, the officers from the public health will take post-mortem samples to be taken to the laboratory for confirmation. This paving way for the dressing of the body and placing it in a body bag. The room where the body was kept is to be disinfected with chlorine water to forestall any further spread of the virus. From here, the body will now be moved into the coffin. The team is to allow the family members around the coffin to pay their final respects to the deceased. The family members must be wearing gloves at all times and be granted time to grieve the dead. The coffin must also be disinfected and remain permanently closed. The team will then proceed to bury the dead.
COVID-19 victim bodies shall be disposed in a manner that protects the living from infections and in accordance with the Ministry of Health burial protocols.
Any infected items used by the deceased, including mattresses that have been stained with the body fluids of the dead, should be burnt away from the house, but upon permission from the family to burn such items. The elaborate government takeover of the disposal of COVID-19 positive victims aimed at limiting contact and spread of the virus. Samogina, Citizen TV, Nairobi.